is looking at facial rejuvenation, and we use a product called Xeomin, which is similar to the product Botox. So it actually relaxes the muscles in the face to help give a refreshed appearance, can open up the eyes, and most people think about that for treating wrinkles. So as we age, we get wrinkles, and wrinkles can come as dynamic or static. And so when we move the face and facial expression, we create little wrinkles or creases, and then over time those can actually remain in the skin. And so we use the Xeomin or Botox type products to relax those muscles and then make the wrinkles appear less obvious, and then over time those creases can actually relax in the skin. So a common place, so we have Doris here with us today. So a common place for the use of this is in what we call the glabellar region. So this is this part of the face here when we are focused or grimace or frown. It brings the facial expression muscles come together, and it causes a crease. One of the very common ones is called the 11 lines that we get in front there. So do a frown for me. So where you can see where her muscles pull everything together. But they also pull the eyebrows down, so this can give us a more serious look. And so then our goal with the Botox, okay, you can relax, is to actually relax those muscles, and it gives a more open and friendly appearance, and also keeps that area there smooth. So we use Xeomin versus Botox because Xeomin actually has a smaller protein component. So we feel like that over time, there's much less chance that people will develop sensitivities to it as we use it over time. It's going to last about 3 to 4 months for her, and so that we know also that if she keeps up with it and we stay on track, sometimes you can actually get a little bit longer lasting effect, and then also the muscles tend to stay relaxed more over that time. So who's a candidate? Most anyone can get it unless you have some problems with neuromuscular problems, or if you're pregnant, or if you have some skin condition where there's either infection or inflammation over the skin, we wouldn't use it in that case there. We have our Botox or Xeomin prepared for us already. So she comes without makeup on already. We've done some cleanser. We also use a topical numbing cream over that to make it more comfortable for her. So for her, when she looks at herself in the mirror, she sees the lines that are developed, and also with lines of facial expression. So we're going to help relax those for her today. When we look at this, as I'm approaching this as well, I'm thinking about what's under the skin, what's the musculature under the skin. So there are muscles that run more vertically, the procerus, which actually squeezes the skin together, and you get the horizontal lines. And then there's a depressor supercilii on the sides, which actually pull down, and then there's a set of muscles called the corrugators, which actually squeeze the eyebrow together. So those are the ones that we're going to relax here today. So this is just some alcohol, and if you've had your numbing cream on already, so that's good. And then we use a very fine needle with this. So you'll close your eyes. Now I want you to kind of frown for me here, and then relax. So when she does that, it actually shows me the muscle that we're going to inject, and then we take a small needle, we go right into the muscle belly, and then we slowly inject about 4 to 6 units into each spot that we're going to. Again, above. Does this hurt?
No.
No. So should be good and numb. And then we're going to go over here to just below where the supercilii are. Do a little injection there for her. Relax that. So she's got a little bit of oozing there. So Doris has also been on blood thinners before, so she might get a little bit of a little dot there, but it doesn't hurt. She's good. Now I want you to frown again, kind of bring it, okay, relax for me. Very good. So we go into the other little muscle there. Let me find the other one on the other side. Okay, again, frown for me hard and relax. She's got a little bit of tail there, relax. So we want to get this one on the other side. So everybody's a little different, very nice. So you can just follow the musculature, Go right into the little muscle belly there, frown again for me, then relax. And then we'll get that, and so this will give her a very nice sort of relaxed look here in the middle. Just a little bit of oozing there from the spot there. It takes about 2 to 5 days for this to kick in, so we actually have people do the facial expressions and work that into the muscle, and then it'll relax this area and she'll get a nice result. As a matter of technique, we want to stay above the rim there, so we don't want to get this to drop. We actually want to go just above that so she'll get some nice relaxation and open up her eyes very nicely. So thanks for being with us today. So if you like and share this video, we're actually going to give a $100 certificate for any of our facial procedures that we're doing here at Flowers Medical Group. And she'll get a good result here. Usually we do follow-up photos and make sure that everything is responding like we expect. We always warn people that sometimes you could get a little bit of swelling, a little bit of bruising with this. It's a very small needle that we go in, and a lot of times we'll do a little bit of ice on this just after, and she'll get a great result. Please join us next week. We're going to do another Facebook Live. We're actually going to have the medical director for Boston Health Diagnostics come, and we're going to talk about advanced cardiovascular testing. So look forward to seeing you then.